Hi, it was lovely being here. I'm so glad that you all came here today. I'm working within the Lambeth Diabetes Intermediate Care team, and we support all the GPs in Lambeth. So when the doctors are having a patient on multiple medications or possibly needing to start an injectable therapy, they refer to our team. My experience is I used to work in the hospital, so I did acute care at St. Thomas's and Guy's, and now I'm working in the community. And I've been a nurse for about 8 to 9 years in Lambeth. And I understand that I think it is really difficult navigating around diabetes because there are lots of different questions and there's lots of things for people to know. And because of it being a chronic condition, it doesn't really go away. So I understand that sometimes it can be difficult in coping with it because it's not something, you know, that you can treat and then it can get cured. But I'm here to try and give you support and answer questions or just anything about diabetes. I tend to look after people with type 2 diabetes, which is different than people with type 1 diabetes. But if you've got questions or wanting to know the difference between the two, or about your medications, about what you can do to help control your diabetes, anything that you can think that or questions you just never got a chance to ask, you know.
So the difference between type 1 and type 2 is interesting, and also like I'm pre-diabetic, so I want to know kind of what I need to do. It's very hard to always understand what you need to be doing other than obvious things like lose weight and eat more healthily, but any tips or advice would be
brilliant. I think that's a really good place to start. Can I just get your name? Sorry. Alan, thank you for the question, Alan. So what Alan has asked, which a lot of people get confused by, is what is the difference between type 1 and type 2 diabetes? And when somebody has type 1 diabetes, it means that their body's not producing any insulin. So somebody with type 1 diabetes is going to need, from diagnosis, will need insulin. And normally they're using like 4 or 5 injections or insulin a day. Versus with type 2 diabetes, you can have type 2 diabetes and be on insulin. It just means your body's producing insulin, but it's just not enough insulin. So usually for the pathway for people who have type 2 diabetes is that they usually start on tablets, and then they may have a first set of tablets, and they'll go to like 2 sets of tablets or 3 sets of tablets, and insulin usually comes when the tablets are not working as well and their body's just not producing enough insulin. So because sometimes people think because they're on insulin that they're no longer type 2 diabetes, but if you're diagnosed with type 2 diabetes, you will always have type 2 diabetes. So that's the difference, is with type 1, the body's not producing any insulin, versus with type 2, you are producing insulin, but just not enough. Okay? And what I was going to add, I don't know if this is helpful or not, but looking at this, I just was looking at the statistics because it's always changing all the time, but there are about 4.9 million people living with type 2 diabetes in the UK, and that represents about 90% of the population. So most people do have type 2 diabetes, and usually about 10% of the population is with type 1. And type 1's usually, people who are diagnosed with type 1 is normally children or young adults. It can happen in older age, but it's very rare. And Alan, you asked me, I'm trying to remember all the questions because you asked.
Being pre-diabetic.
Okay, so before I even go on to pre-diabetes, I think it might be helpful to clarify how do we get diagnosed with diabetes? Does everybody, because normally you go to the GP and they do a blood test. Yeah. So when we're looking at doing a blood test for people with type 2 diabetes, not for type 1, they do a blood test, and what they're looking at is something called HbA1c. I wish I had a board, I feel like a teacher. So HB stands for hemoglobin and A1c is sugar. So when you eat anything, the sugar gets attached to your red blood cells, and the red blood cells last for approximately 2 to 3 months. So when we do the blood test, where the GP does the blood test, it's able to see how much circulating glucose is in your body for the last 2 to 3 months. So it gives us an average of what's happening. So it's not like when they take a finger prick of your finger and they check, you know, sometimes they just they prick your finger and you get a reading. That tells us what is happening, like a snapshot right at the exact moment. Versus when you go in for the venous blood test, when they take it from the arm, that is giving us an average over 2 to 3 months. So when we're diagnosing whether you have pre-diabetes or diabetes, we tend to use, usually, we tend to do the venous blood test. Unless they do a finger prick and it's very high, then obviously we know that you have it. But usually it's to do a venous blood test. And typically they do 2 to diagnose you. And when we're looking at the HbA1c, I'm not sure anybody knows what the values are.
Over 48 is...
That's I like when people help because I want it to be interactive. So Alan is right. So to have a diagnosis of diabetes, the HbA1c must be 48 millimole over mole, or sometimes some people say percentages, which is 6.5%. But we tend to use the 48 more because the rest of the world does it millimole over millimole. So pre-diabetes is usually when you're 42 to 47 is for pre-diabetes. Just so that everybody understands. And Alan, and a lot of people, it's nice when you're in a situation that you get diagnosed and it's pre-diabetes in the sense that you have some time to work at things. And a lot of, I know it's hard, a lot of it is to do with lifestyle. And with diabetes, the older you get, there are lots of risk factors with developing type 2 diabetes. And part of it is genetics. Part of it is family history, and if you're women who've had gestational diabetes, tend to be more prone also to getting diabetes earlier. But family history is a very strong one, and genetics too. These are things that we have no control over. But the things, I guess, when you do see somebody or the GPs or talking to people, they do kind of focus on the things that you can change. And that tends to be lifestyle. So it's a harder one to do, I know, but it is really looking at how much we're eating, because we all tend to overeat a little bit. I know I do myself. So, and when we're looking at diabetes, what I try to focus on is doing things you enjoy. And I don't mind vegetables, but it is when you're thinking about a plate of food, having food that you enjoy eating. Because there's no point in changing your diet or making changes when you're not going to sustain it. So even if it's a small change, because sometimes we get so scared and we want to make we want to make a drastic change, and it's so difficult to make change, I think personally. So I think sometimes small changes are better, and then we can gradually keep making small changes over time. And that will help us with our overall goal. Because if we try to change too much too quickly, a lot of times we fail in what we're doing, and that just makes us feel a bit more, depressed, or just you don't feel like tackling or wanting to. So I do think small goals are better, and even if it's just doing like 10 minutes of exercise every other day, or walking, or find something that you enjoy doing, if it's dancing, or even going to a park with friends. And we do find if you're doing an activity with somebody or planning it with somebody, it makes it easier for you to continue doing it. And I'm sure you all could give me advice about food, but a lot of what we say is trying not to have too many carbohydrates or too much sugary foods or desserts, that to try and cut down. And the main big culprit when I was in hospital is trying to cut out juices. A glass of juice has about 6 to 12 cubes of sugar, depending. So juice, any type of juice, even if it's freshly squeezed juice, it has a lot of sugar, and it's much better to have the actual fruit because you're getting the fiber. I think fiber is really important because it helps to keep you feel full and helps the blood glucose levels stay at a steady level.
Thank you.
Does that help? Sorry.
How much fruit are we supposed to have?
That's a really good question. Can I ask? I love finding out people's names when I'm talking. Patricia. So Patricia's asked, how much fruit should we have a day? Does anybody want to give a guess, or?
5 portions a day?
That's what's on the TV, and I know where you came up. When they say
Fruit and vegetables. Yeah?
that is That's correct, but actually, that's correct. So the guidance is five pieces of fruit or vegetable a day. But you can have as much vegetables as you want. Hi, sorry. I just want to thank you. See, when it comes to fruit, we say not to have more than 3 portions a day. So it's a little bit different. I know it says 5 of fruit and vegetables, but with vegetables, we encourage you to have as much vegetables as you want. But when it's with fruit, because fruit has sucrose or fructose or sugar in it, that it is to do with 3 portions of fruit. And a portion of fruit is what you can hold in your hand. So it's an apple or, an orange or a piece of pear. If you're having a mango, which I love mangoes, it tends to be, I know it's unrealistic, either getting a small mango or cutting it in half. So if you're having even like watermelon, it's about having slices. So it's just what you can hold in your hand. It gives you an estimate of, and everybody has a different, and unfortunately, I have a small hand, so I can't really have too much. But anybody who has a bigger hand, you're allowed to have a little bit. So that's why we say a hand size, because it kind of, depending on your size, it gives you a better estimate of how much you can have. And what we, sometimes when I'm doing clinics, patients will come and say, well, I'm having my 3 portions of fruit a day. But what they tend to do, which I could understand too, is they'll have it all at one time. So they'll have it, they'll have like a big fruit salad. And
that's what I tend to do. I put every fruit in it. So how much do I have?
so what our dietitians recommend, because I love doing that, I can understand that. What they recommend is that not to have it all at one time, because it will cause a spike with your blood sugars. So if you have a small bowl, even if it's just a small bowl, just have it like, I have like this really small bowl, just if you're liking 2 grapes, you could do a few segments of orange, if you like having a mix. But it's fruit are one of those things that I love too, and I know it's difficult, but it is really about trying to have less. So even whatever you're doing, try and have a little bit less. Yes.
Steve.
Hi, Steve.
How would it be to eat through the day 6 satsumas, 6 to 8 satsumas, and 2 or 3 bananas?
It was me.
Okay. Well, unfortunately, did everybody hear the question? So I'm going to repeat it just because hopefully my voice is nice and loud and clear, that everybody can hear me. It's Steve. Steve had a really good question in response to his wife. He was, and maybe, and your name? Christine. And he was wondering, well, what, and you could probably give me a response today or help me. He was saying that Christine likes to have 6 satsumas, minimum 2 bananas, and I think there was one more.
And probably other things.
Okay, so what?
That wouldn't be bad because it's fruit, and Christine says, my mum always told me to have lots of fruit in case I'm hungry. It's a good thing. You just told me that over 2 might be too high on the sugar level.
It is. I mean, if you have pre-diabetes or diabetes, and I'll be really personal with you guys. Both my grandparents and my father and almost all my aunts and uncles have diabetes. For me, I tend to be careful just because I know that I'm at an increased risk of developing type 2. And I'm from the Caribbean. And when you're I'm from Trinidad, and a lot of Caribbean people are more prone to have diabetes, and you're usually getting it at a younger age. So even though I don't technically have to yet, I try to be careful not. I love fruit, and it does have lots of vitamins and minerals, but for most people, it does cause, it's too much of a good thing. Although it's good for you, it does cause spikes so if you're on medication, for most people, it will cause them it will cause your sugars to spike a little bit.
And what would be the outcome if you get diabetes? What is it as a disease? I was classed as a type 2 a few years ago,
Yeah.
and I changed my diet. And then they said, oh, you're nearly pre-diabetic.
Yeah.
But they didn't say what diabetes was.
I think Stephen has a really good question, because a lot of times you go to see your doctor. Did everybody hear that question? Sorry. Yes? So he kind of, and maybe if some of you know the answer, because I like when it's a little bit more interactive if anybody's brave. He says that he was diagnosed with type 2 diabetes, and obviously he had the advice about diet, and he did really well that it's kind of the blood sugars actually went to almost pre-diabetes now because of the changes he did with lifestyle.
That was after. I mean, maybe I'm relapsed and I'm just as bad, because I eat a lot of biscuits and cake. I love it. And I just haven't been tested lately, but I just wonder what the long term, you know, if you've got, for example, leprosy, your fingers will fall off.
Okay.
I know the results of leprosy. What's the results of diabetes?
Okay, this is a little bit more of a heavier topic. He wants to kind of know what can you expect to happen, or what can happen when you get diagnosed with type 2 with diabetes. And from all the research, because they've done lots of really big studies, and there are lots of factors. So it tends to be when you're diagnosed earlier with poor control, you're more at risk of complications. So the reason, and it's not just that it's a metabolic disease. So when we're thinking of diabetes, we're not looking at diabetes as separate. Usually for a lot of people, when they get diagnosed with diabetes, they may have high blood pressure. They may also be, their cholesterol level may be a little bit high. So if you're looking at, it's very rare that I see somebody who may not be on tablets for their blood pressure or for cholesterol too. So because of they're all working together. So when your blood levels are high, glucose levels are high, it can damage your blood vessels. And that's on a very simple, just to make everything really as simple as I can. So and it makes it really tricky, because a lot of patients, even when they're, you know, if you've got cancer, you're normally feeling well. And what's dangerous about diabetes is that you can have really high blood sugar sometimes and you feel fine and you don't know. And I think that's where it's a bit scary, because there are lots of people walking around and it's really hard to make changes if it doesn't affect your health. And it's like, well, symptoms, yeah. And not everybody, some people, even with really high blood sugars, I'm like, are you not going to the toilet more often? Or I kind of talk, and not everybody has the same threshold for getting symptoms. But unfortunately, when the levels are raised or elevated, it does damage your blood vessels, and that's your large vessels and your small vessels. So we're looking at the heart, the kidneys, your eyes. It's making the blood stickier. There's more risk of the blood clotting. There's so many things that are happening when you have raised blood sugars, but ultimately it can lead to damage of your organs, and that's what we want to prevent.
Yeah, that sounds fine.
And everybody here, just to I will answer more questions, I'll talk about symptoms too, but it's really important that we're going to the GP regularly, at least once a year, to check what's happening with your diabetes. That should be something that you should be going to get your blood test done at least once a year. And if you're starting to feel unwell or you're having more symptoms, I'm sure the doctor will arrange for you to get another test to see if something is changing, because obviously we don't want to wait 6 months if something is happening, or if your blood sugars. But normally for people with type, what's your name again? I'm going to talk about Claudette. That's a pretty name. So Claudette asked about symptoms. Does anybody know what the symptoms are if you have type 2 diabetes? Yeah, that's good. We're going to the toilet more often, because dry mouth, that's correct. And you ever think about why you're getting these symptoms? Why is that happening? Because as we know, it's toxic when your body has too much sugar. And even though you may be feeling well or may not have the same level of symptoms, what your body does is it tries to get rid of the extra glucose. And that's why you're going to the toilet more often, because the body knows it's not good. So it is trying its hardest to get rid of as much glucose as you can. So it's excreting it through the kidneys, and you're passing extra glucose in the urine. And when you're passing extra glucose through the urine, because you're passing out more fluid, you start to get dehydrated. And that's why a lot of people who, if the blood sugars are high, they may tell you they're feeling thirsty and wanting to drink more, is because they're getting dehydrated, because they're passing out more and more sugar because they're going to the toilet more often. And when your blood glucose levels are high, bugs love glucose. It's like food. So a lot of patients, if somebody's coming to their doctor and they're realizing that their skin is really dry, or they're getting lots of infections like urinary tract infections, or even any type of infections, it can be brought on, especially urinary tract infections, because the blood sugars are high. So if you're getting infections or dry skin, going to the toilet more often, feeling tired because you need glucose for energy. So I would never sit here and tell you to cut out carbohydrates or cut out fruit, because you need some fruit for energy. So, but because your body is not able to use the glucose properly, because when you get diagnosed with diabetes, usually there are things happening a few years before you get diagnosed in the pre-diabetes stage. What can happen if you've got some weight around your tummy? We call that insulin resistance. And that means the insulin that you have on board doesn't work as well. You know, and when people, I know that most people with type 2 diabetes, they tend to have a little excess weight around the stomach. But lots of people with type 2 diabetes are really slim. So it has to do with age. There are lots of different factors that interplay. And usually when somebody is slimmer, it's to do that their body's just producing less insulin. It's not to do about insulin resistance. So they're different, you know, and there are different types of diabetes too. But yes. So as we talked about symptoms, so if you are getting any symptoms where you feel like you are going to if you are diagnosed with type 2 diabetes and you do find that you're feeling really tired, because, you know, or you're going to the toilet more often, you're feeling really thirsty, getting infections, get the doctor to recheck your diabetes. Because it may be that the tablet that you are on may not be working well enough, and they may need to add on another tablet, or maybe go through things that you might possibly can change with your diet, or maybe starting to do a little bit more exercise, because diet and exercise has a profound effect on helping control the diabetes.
Someone online has asked about how does honey instead of sugar affect diabetes?
That's a good question. So somebody's just asked about how does honey versus sugar affect the diabetes? Does anybody want to hazard a guess? What do you think? Honey is any better than sugar?
I would say honey is a lot better than sugar, yes.
Natural honey. A lot of people would say that, but unfortunately, it has the same effect. Because if you have 3 teaspoons of honey or 3 teaspoons of sugar, it gets converted into glucose. So any type of sugar, whether it's natural sugar or whether it's actually processed sugar, it's still going to be converted into glucose, and it will cause your blood sugars to spike. And a lot of people get that. You know, people think by switching over from sugar to honey that it's going to make a positive change, but unfortunately, it's going to have the same impact when you digest. And a lot of patients, when they do have low sugars or hypos, sometimes when some people can have low sugars, we actually recommend honey, because it brings up the sugars very quickly.
I've got a question on type 1. Do you want to?
Do you mind if we just answer this one online and then I could come to you next? Thank you so much. Yes.
So this person has only recently been diagnosed with type 1 diabetes, and at the moment they're struggling in the morning, having low sugars and hypos through the night. Do you have any advice?
Yeah, that's a really good question. People who, individuals with type 1 diabetes, from my experience, they tend, because of how insulin works, insulin helps to bring down the blood sugars very quickly, that they're more at risk or more prone to having low sugars. If the trend or the pattern is that they are having low sugars overnight or hypos overnight, it normally indicates that they're having too much insulin at night time, because lots of, without knowing too much, a lot of people are either on a pump. I'm not sure if he's on a pump or if he's on something called a basal plus, which he's on a bit of long-acting insulin twice a day, and then sometimes fast-acting insulin with food. But if anybody with type 1 diabetes should be under the hospital diabetes team, and there are inpatient specialist nurses who can help to navigate, and sometimes they're on the Freestyle Libre where they can scan their blood sugars. So he's obviously on too much insulin overnight. That's causing the blood sugars to dip, and that's not good to have. Although I get as concerned with very high blood sugars, I am just as worried as low sugars. They're just as dangerous. So we really try to avoid high and low sugars. So he should have been referred to the hospital diabetes team, and I would definitely get in contact with one of the specialist nurses, because they should be giving him advice or support, because it's worrying to hear that he's having hypos, and usually it's indicating that he's having too much insulin overnight. If you could ask him if there's anything, if that helped, if there's any other questions. I'm sorry. And then I'll come to you, and then I'll come to you. Just because I just wanted to see if that helped answer his question. Sorry.
No, that's fine. It's on a slight delay, I think.
That's okay. Well, I'll answer the next question if he's got anything, yeah, but it's definitely, yes.
Hello.
Hi.
My name is Mike.
Hi, Mike.
From the bowel surgery.
Okay.
And I'm not a diabetic, and there's no family history, but like a lot of people, I enjoy sweet things. And I was going to talk to you about certain things that I would like to avoid that I may get diabetes. Now, we've touched on fruit,
Yeah.
and I was going to ask you about that, and a particular fruit. Steve, I believe at the front, talked about 6 satsumas and 2 bananas a day.
Yeah.
Am I right in thinking that 1 banana can contain up to 6 spoonfuls of sugar?
Bananas are quite high in sugar, especially if the bananas are ripe.
So surely that's not a good idea.
You're completely.
That's why I asked the question.
No, it's not. It really.
I don't think it's a good idea.
So my question is, what kind of, and we talked about the fruits that we could eat. Is there a good idea to make a smoothie out of fruits?
I see a lot of patients who start juicing or having smoothies, and that kind of brings them from pre-diabetes to diabetes, because it's putting a lot of because if you're doing that, a lot of people have gone onto these smoothies where they've cut out meat and done that, and it really does. A lot of pre-diabetes become diabetes because of the amount of sugar in fruit.
And you talked about not eating too many fruits at once.
Exactly.
So if I make a smoothie and have half a glass at one sitting and half a glass later on in the day, is that a good idea?
The dietitians would say it's better to just have the actual fruit. You can possibly do it, but because normally with fruit, because with smoothies, it's having a lot of fruit. If it is something you enjoy, obviously having less is better, but I tend to try to get people not to have smoothies, or even get the innocent smoothies, because
you're saying it's better to eat fruit.
It's much better to eat the fruit.
Rather than make a smoothie. Okay,
Exactly.
My other question is, I'm very fond of dark chocolate.
Okay.
And if we took a bar of chocolate, how many pieces would you recommend a day one should eat?
Well, you're very lucky because you don't have diabetes. And dark chocolate is a bit better because you tend not to eat as much.
Yeah.
Like strong cheese.
Yes.
And I think having 1 or 2 or 3 pegs a day is fine. As you don't have diabetes, it's just about moderation.
Yes.
And not having a bar at a time. So it's just thinking about what you're eating. That sounds very reasonable to me. Yes.
Yeah.
And that.
Thank you.
My pleasure. I love that everybody's asking me all these questions. This is wonderful. What's the next question?
I'm Louise.
Hi, Louise.
I just wanted to
do you know prednisolone, how it affects? Because that sent my blood sugar.
That's a brilliant. Louise asked a really good question. She's asked about a tablet, and I'm not sure everybody knows about this. There's a tablet called prednisolone. It's a steroids tablet. And I didn't mention that with one of the reasons, remember I talked about things that can cause your blood sugars to spike. We talked about, lifestyle. But also if you go in hospital and you're put on steroids, it's very, very common that any type of steroids, even though you need steroids, I'm not saying not to take it, but one of the side effects of having steroids is that it does cause your blood sugars to go really high. And we've had sometimes when we've had patients who had steroids, we need to start insulin because of it does, especially depending on their dose, if you're on 20 or 30 milligrams. For lots of patients, especially if you have diabetes or even pre-diabetes, it will cause the sugars to spike. So normally when I was in the hospital, we were visiting patients, we always try to make sure that for patients who are put on big doses of steroids that they get a blood test done and that the nurses in the wards check their blood sugars because a lot of patients do need insulin and it can put on. There are lots of things with steroids, but unfortunately sometimes you need it for whatever healthcare reasons. But that's a really good point. So if anybody who has type 2 diabetes, if they are put on steroids, it's really important that you go to your GP so they're aware and that you are checking your blood glucose levels more regularly because it can cause the sugars to spike and you can get really unwell. So that's a really, thank you, Louisa. So that just for general, I think we could all learn from each other. So I think all these questions are kind of highlighting things that you know or experiences that other people could learn from, which is really valuable. Thank you. And even asking about the fruits and stuff, I think you all had really good questions. And I know it's hard making changes. So even if you could cut down the 6 down to 4 and gradually, but it's just kind of monitoring. The whole thing is that if you do have diabetes, that you are going to see the GP and that it gets monitored. And if you start to feel unwell, that they are aware, because it's not really what you're taking, but it's about the control. We know that people who have better control, they have much better outcomes. And my role is I want to help patients with diabetes feel more confident in managing their diabetes, but and also have a good quality life. I don't want people to we're trying to avoid dialysis, we want you to have energy to be able to do all the things you want to do, go on holiday. So that was part of the reason why we're striving. It's not just for the sake of numbers, it's because about quality of life. It boils down to good quality of life and supporting everybody. Last thing, sorry, yes?
So just this woman online.
Yeah.
So she said that she had been referred, but they put her on 5 insulin shots a day, 2 long lasting and 3 with food.
Yes.
She's found it hard to get support as a new person being diagnosed, and so she wants to know if there's any good support groups out there for her. And when she was admitted to hospital originally, she was admitted with high sugars, so it's all quite confusing.
It is very confusing. With type 1s, it's a lot of managing different insulins. I definitely, whichever hospital, there should be a inpatient nurse to support her. There are forums on Diabetes UK, but I do think when it's managing insulin doses, you need a healthcare professional. So yes, it's good to do group support where they can give you tips. And if she should be on, there is something called she should be on not the insulin with food, but the long-acting insulin that she's taking. That would, I'm not in front of her and I don't have all the numbers, and I don't think it's safe for me to do something virtually, but she could even just call her GP, because it does sound like she needs a little bit less of the long-acting insulin, because we just want to avoid, it's really getting blood sugars within a range, so they should have an optimal range for her, where she should be checking her blood sugars before food, and there should be levels. But Diabetes UK does have forums for type 1 diabetes, and maybe that might be a good place for her to start, but also get in contact with the hospital, because they're there to support the individual. And it is very confusing and complicated being on lots of different injections, and I do empathize, and hopefully that would help. Yeah. I'm going to wind. It was such a pleasure. I really enjoyed doing this talk. One last question. Yes?
would it be better, like if when you're cooking rice, to strain the rice, and if you're cooking potatoes, would it be better to strain it to get the starches out?
They haven't done enough research, but what I do know with rice, I tend to, when I'm doing it, I think it's a little bit better, but there isn't enough strong research to say. Some papers have said yes, some have said no, to be honest. So when I'm looking at rice, what we tend to say is if you're having white rice, have basmati white rice, because it has a lot more fiber. So with white rice, basmati rice is really good. And obviously brown rice is better than white rice because there's more fiber. So it helps your blood glucose level stay at a better level. And if you're looking at potatoes, try to have not more than 2 or 3 small potatoes or 1 large potato. It's really more about portion size.
Thank you.
Okay, thank you so much.
Thank you very much.
Thank you.